Hey everyone, welcome back to Vedic Sage. I'm Dr. Dhaliwal, and today we're going to be discussing the topic of heartburn, and more specifically GERD, which is gastroesophageal reflux disease. It's likely that we all know the symptoms of heartburn because it's the most common digestive disorder in the United States. Now, this may be a shocker, but contrary to popular belief, heartburn and GERD are actually caused by too little acid as opposed to there being too much acid or hydrochloric acid within the stomach. It's interesting because we often think that there's too much acid in the stomach or hydrochloric acid in the stomach as if it's flowing and overflowing of the stomach and backflowing into the esophagus, creating these signs and symptoms of heartburn. Three simple things to take into consideration. One, the stomach is not overflowing with acid or hydrochloric acid. Two, there's a sphincter, the lower esophageal sphincter, which is at the lower portion of the esophagus, and the function of this sphincter is to prevent reflux or backflow of gastric contents into the esophagus. And three, we need to take into consideration that even a small amount of acid, which comes from the stomach, this hydrochloric acid, even a small amount of that acid entering into the esophagus will create signs and symptoms of heartburn or GERD. Therefore, by putting all these three considerations together, we can say that heartburn is mainly due to a dysfunction of the lower esophageal sphincter not properly doing its job, which is to prevent the backflow of the stomach acid into the esophagus. So the billion-dollar question is, if heartburn and GERD are primarily an issue of low stomach acid and a dysfunction in the lower esophageal sphincter, why do people even take acid-suppressing drugs in the first place? And unfortunately, the answer is someone has to make billions of dollars annually. Year after year, this is a multi-billion-dollar industry. And unfortunately, I think many people are misinformed or disinformed of the root cause of acid reflux. So let's take a closer look at the real causes of the underlying problem, which is resulting in acid reflux, heartburn, and GERD. So it's well accepted and universally agreed upon in the literature that GERD is caused by an increase in the intra-abdominal pressure, and acid reflux occurs when pressure causes gastric distension or bloating, and this pressure pushes the stomach contents, including the acid or the hydrochloric acid, through the lower esophageal sphincter and into the lower portion of the esophagus. Even further, to take the focus off of stomach acid or the hydrochloric acid, we should say that the stomach acid is your best friend. The main cause of GERD begins with low stomach acid or low hydrochloric acid. And as we know, this stomach acid is required for proper digestion of food. Not only does the stomach acid help to digest both carbohydrates and proteins, but it also helps to inhibit bacterial overgrowth. The normal pH of the stomach is thought to be less than 3 as far as the pH, and the normal stomach acid provides conditions which most bacteria cannot survive. However, as the stomach acid becomes less acidic, it begins to create a setting or an environment which the bacteria can not only survive, but begin to thrive. And this leads to bacteria overgrowth. So putting all this information together, we can say that with bacterial overgrowth, again, due to low stomach acid, and poor digestion of proteins and carbohydrates, once again, because of low stomach acid levels, this leads to a process of fermentation within the intestines. And this process of fermentation leads to gas production, which increases the intra-abdominal pressure. The increased intra-abdominal pressure provides the driving force that's required to overcome the lower esophageal sphincter tone. And as a result, the acid from the stomach, the hydrochloric acid, enters into the esophagus, which creates that burning sensation associated with heartburn. Now, the basic principles of how to manage acid reflux, heartburn, or GERD from a natural approach is, one, we have to replenish the stomach acid and the enzymes required for proper digestion of the nutrients. And two, we have to avoid factors which are promoting this bacterial overgrowth. Likewise, we have to find ways to promote this beneficial bacteria gut flora. And lastly, we have to restore that healthy gastric mucosal lining. So now let's take a look at certain factors that actually result in bacterial overgrowth. And it's been shown through scientific studies that a high carbohydrate diet actually promotes bacterial overgrowth especially in patients who already have underlying low stomach acid levels. Even worse, the overgrowth of bacteria, for example, H. pylori, is thought to further inhibit the production of hydrochloric acid, which will soon lead to a vicious cycle that unfortunately many patients are well aware of. Therefore, one may want to consider a low carbohydrate diet initially just to help reduce the process of fermentation, gas production, increase intra-abdominal pressure, which are the steps leading to all of this symptoms of heartburn, acid reflux, and GERD. So after considering a low carbohydrate diet to help reduce or inhibit that bacterial overgrowth, you may want to consider some bitter herbs. And bitter herbs have been used traditionally in cultures for thousands of years. These bitter herbs have now been confirmed with scientific studies to have the ability to increase the flow of all these digestive juices. So this implies having the ability of increasing the secretion of hydrochloric acid from the stomach, increasing the flow of bile from the gallbladder, and even increasing the pancreatic juices, which are required for properly digesting the proteins, fats, and carbohydrates. Likewise, the better the process of digestion and absorption from the intestines, the less likely the process of fermentation by the detrimental bacteria that's located within the intestines. So, some bitter herbs that you may want to consider include ginger, fennel, dandelion, golden seal root, peppermint, and even milk thistle. Likewise, some traditional remedies that you would want to consider are apple cider vinegar, works wonders, lemon juice. You may want to consider raw unpasteurized sauerkraut or even raw pickles. And of course, you may want to consider probiotics. Okay guys, I hope this was helpful. I hope this brought some insight into the true underlying cause of acid reflux, heartburn, and GERD. Make sure to like us down below, put some comments down in the comment section, and provide some insights or suggestions that you guys have to help benefit other people who are suffering from this condition. Okay guys, take care and see you next time.